My friends, this is Dr. B, the best doctor in medicine. 30 plus years of clinical medical experience at high level. Today, Dr. B wants to tell you what you need to do in case your high blood pressure, your hypertension is difficult to control. What should you do if your doctor, your family doctor, your general practitioner, your internist has trouble controlling with medication your high blood pressure, your hypertension? Very important question, extremely important question. So listen carefully. Remember that at least 30% of the adult population in the world suffers from hypertension. 30%, that's almost 1/3. I'm not talking here about children, right? Remember, I'm not talking about children. I'm talking about adult population. The problem of high blood pressure in children is a completely different thing. I'm talking about adults. 30% of the adults in the world suffer from high blood pressure. Almost 1/3. It's the most common cardiovascular disease in the world. The most common cardiovascular disease in the world, right? So, if you do have high blood pressure, if you are an adult and you do have high blood pressure, you have to remember that in 90% of cases, this high blood pressure is so-called genetic, also called idiopathic. Idiopathic means there's no cause, but actually it's genetic. Also called essential, also called primary hypertension. Different names to designate the same cause, which is genetic hypertension that we get from our parents, right? We haven't been able to determine a single gene, but we know that it's transmitted genetically. This essential, also called primary, also called genetic, also called idiopathic hypertension makes up 90% of cases of high blood pressure, right? But in 10% of adults who do have high blood pressure, there is definitely a cause that we can find. It's not just the genetic one, right? For which we cannot find a cause, it's just genetic. In 10% of these adults who do have high blood pressure, there is a cause. And what is crazy is that by far, most of the time, when your family doctor, your nurse, your general practitioner, your family physician finds a patient who has high blood pressure, right? What do? Well, they say, oh, okay, sir, okay, ma'am, you do have high blood pressure. I'm going to make you measure at home your blood pressure value. Make sure you have a little log, right? A little diary like that. And also make sure that you buy a little monitor and make sure you record your blood pressure. They give you instructions how to do that. Good way to measure blood pressure at home. Then they send you to the lab to do the standard routine blood test, right? A complete blood count with differential, a complete metabolic panel, all this to check your red blood cells, white blood cells, lymphocytes, sodium, potassium, chlorine, blah, blah, blah. They make you do a liver function test, kidney function test to check your liver enzymes, to check your kidney functions, right? Nothing out of the ordinary. They don't do any other detailed test, right? In people who have high blood pressure. And then, of course, the guy comes back or the lady comes back to the clinic 2 weeks ago. Oh, look at that, doctor. My values are pretty high, right? And the doctor going to say, oh, okay, well, we need to start you with a blood pressure medication. And of course, they're going to start with one medication at low dose. They're going to see within a few short months how the patient is going to respond. Now, if you do respond to that medication and your blood pressure values become normal, then good for you. Let me just remind you that a normal blood pressure value in an adult, normal, means that your systolic, means the top number has to be less than 120 millimeters mercury, and and your bottom number, which is the diastolic, has to be less than 80 millimeters mercury. Both of them less than 120, and this one less than 80. I posted some videos about this. Please look at them, watch them. And make sure that you understand that good for you if your values are below 120 and below 80. But many times your doctor is going to be content with values that are not optimal, that are okay, right? Means maybe elevated values, maybe stage 1 high blood pressure, and is going to tell you, oh, look at that, your blood pressure used to be stage 2, now you are stage 1, right? Don't be content with that. You need to lower them to normal, less than 120, less than 80. Now, if you don't respond to the first medication at low dose that your doctor gives you, then your doctor will increase the dosage. The problem with increasing the dosage is that many times patients have side effects, right? Because you increase the dosage of the medication, so higher risk of side effects. So then you're going to come back, tell your doctor, I have a lot of side effects. He's going to decrease the values back, but add a second medication. So now you are at 2 medications to control your high blood pressure. And for now, your doctor hasn't done any other test that he should have done to see why is it that your hypertension, your high blood pressure is so difficult to control. Why is that? He's not going to do that. And I'm going to tell you what your doctor needs to do and what you need to do, tell your doctor to do, right? So your doctor going to add another medication. And by adding another medication, of course, more side effects, right? But maybe your value is going to go down. Good for you. Okay, your values are normal, less than 120, less than 80, right? Good for you. But what happens, like in many cases, if your values drop, but not enough to be the optimal, ideal, normal blood pressure, which is less than 120 for the systolic and less than 80 for the diastolic. Your doctor's many times going to say, well, you know what? I don't want to put another third medication or increase your dosage because you're going to have side effects. Let's be happy and content with a stage 1 high blood pressure because you used to be stage 2. Don't accept that at all. Being a stage 1 high blood pressure on the long term is very harmful, even though it is stage 1, also called mild to moderate hypertension. No. A disease that is mild to moderate can also harm you from within, although at a slower pace over a longer period of time, but it will kill you slowly but surely compared to a stage 2 hypertension called also severe hypertension, right? So your doctor gonna be, oh, okay, I don't want to increase, let's be happy with that. No. In case you have reached such a situation and that your high blood pressure is not controlled by 2 medications, and your doctor doesn't know what to do because your high blood pressure, despite 2 antihypertensive medication, is still not controlled optimally to normal optimal levels, which is the systolic less than 120 and the diastolic less than 80. What should you do? Well, you need to tell your doctor what many family doctors and internists and general practitioners don't know and don't do, and therefore don't do. And I wrote it down for you. You need to tell your doctor to do a blood test to check you for primary hyperaldosteronism. primary aldosteronism. Some people call that primary hyperaldosteronism. But it's okay if you just put primary aldosteronism. Primary aldosteronism. Aldosterone is a very, very important hormone that is produced by your adrenal gland. Adrenal gland. On top of your kidneys, left side and right side. On top of your kidneys, you have a tiny gland about 1 inch by 2 inches. It's about 2 inches high, 1 inches wide, right? Very important organ without which we cannot live. If we didn't have adrenal gland, we would die. Among many hormones that this adrenal gland produces, there is one that we call aldosterone. Aldosterone. Now, if your adrenal gland, for many different reasons, produces too much aldosterone, and that's seen about 10 to 30% of people who have high blood pressure that is resistant to treatment. Among people like you who have high blood pressure that is resistant to treatment, means they need at least 2 medications to lower their value, and also despite having 2 medications, their high blood pressure is not completely controlled, means their value is not less than 120 and less than 80. This is the ideal number. My values are 105 over 70, and I'm 50 years young. I don't take any medication, right? My top number is at 105, and my second number is at 70. This is optimal, normal values. So if you do have high blood pressure that is difficult to control, means you need at least 2 some people need 3, at least 2 medication, and even if you have 2 medication, despite that, your values are not perfectly under control, like Dr. B's values that are naturally healthy, right? Less than 120, less than 80. Make sure that your doctor, who doesn't know about this, because he's a family doctor, he's not an expert in endocrinology, right? He's just an internist, he's a normal, I'm not criticizing, everybody's different, right? But his knowledge is limited because he's a family doctor. He's a general practitioner. He's not a specialist, right? Make sure your doctor makes you do the test to look. Say, doctor, hey, I saw online Dr. B, the best doctor in medicine, told me that there is a 10 to 30% chance that I might have primary aldosteronism. Can you please, doctor, make sure that you check me for primary aldosteronism? And this can be checked very simply with a blood test, where they measure the ratio between aldosterone, which is the hormone produced by your adrenal gland, and another hormone called renin. I don't want to go into the details. Let me write this name renin for you. But you don't need to know this name renin, which is another hormone, right? This is called renin. You see, renin, right? So the blood test that will look for primary aldosteronism will measure the ratio between aldosterone and renin. And if the ratio is above a certain normal value, that's it, you got primary aldosteronism. 10 to 30% chance that people who do have high blood pressure that is resistant to treatment, means difficult to control, means they need at least 2 medication, and even 2 medication they need high dose, or with regular dose Their values are still not optimal. 10 to 30% of these people suffer from primary aldosteronism, this disease. I don't want to go into the detail, but remember that the knowledge of your doctor, your family doctor, your general practitioner, your internist is limited, right? The same way my knowledge in mathematics, which is excellent, right, is limited. I'm not a mathematician, even though I'm a very, 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 very good in mathematics, right? So my knowledge in mathematics, same thing for physics. I'm not a physicist, but my knowledge in advanced physics is extremely good, right? But my knowledge in physics is limited. I'm not a doctorate in physics. So your doctor, your family doctor, is not a specialist in endocrinology. So he doesn't know about this, right? He doesn't know that people who do have difficult to control their blood pressure have 10 to 30% chance that they do have primary aldosteronism, and many times they won't take the headache to send you to a specialist. They will tell you, well, it's okay, you're okay, your blood pressure values are lower than what they were, let's be happy and content, blah, blah, blah. You see, medicine is becoming a disaster in America. I posted a video about this. Doctors, whether in hospital or private clinic, are extremely busy making money, managing their business, right? They want to make a ton of money to save for their retirement, to pay for their villa in Mexico, to pay for the brand new Ferrari that he just bought, right? So he needs to see a ton of patients every day, 25, 30, 35, 40 patients. In and out, the doctor gonna go from one room to the other, right? He's gonna spend 5 minutes with you. He's not gonna spend too much time. He's not going to dedicate time to you, right? He's just going to spend enough time to bill your insurance, then kick you out of the clinic, go to the other room and see another patient, so that at the end of the day, at the end of the month, at the end of the year, he can make a ton of money to pay for his vacation to the island of Capri in Italy this coming month in August, right? Right now, July 2025, right? So this is how medicine has become. It is extremely bad, and it's going to get worse and worse and worse. So make sure you become your own healthcare advocate. Make sure you advocate for your own healthcare. Make sure you grab the bull by the horn. Make sure you don't entrust your mental health and physical health 100% in the hand of your doctor, like they used to do generations ago, when the doctor used to be the God and you wouldn't say anything, no ask, no question. You would trust the doctor like the guy is the God, right? No. Times have changed. You need to be your own healthcare advocate, and if you feel that your healthcare team doesn't give you what you deserve, doesn't treat you good, doesn't take good care of you like you deserve, change. There are millions of other doctors that you can find. The same way for my dentist, I had to kick out those 2 previous dentists who were a disaster, didn't care at all. They were rushing me. They didn't take care of anything, didn't explain me anything. I knew they were botching and making a lousy job so that he can run in the other room, make more money. I changed them twice. Now the 3rd dentist that I have is an excellent one. He explained to me my x-ray, explained to me what the catso is wrong with my teeth. He explained to me what the catso he wants to do, asked me my opinion, what treatment I want. Do you want to have this? Do you want to have that? He's excellent, and God willing, he will never retire, just like me, never retire, so that I can have it until I'm 100 years old and die peacefully and healthily in my bed, in my sleep, God willing. So it's the same thing. Change your doctor. If you feel that your doctor doesn't care, change your doctor. And remember that your doctor is, as I said again, not perfect. His knowledge is limited. He doesn't know everything in medicine. He doesn't have the time to keep in touch with the latest scientific discoveries in medicine, latest guideline, latest medication, latest surgical techniques, blah, blah, blah. I personally, Dr. B, read, despite being 30 plus years in medicine, every day I spend 1 hour to improve my medical knowledge. I receive 8 high-level medical journals, right, at my apartment per month, 8 per month. Every day I spend 1 hour to upgrade my knowledge, to improve my knowledge. New discoveries, new medications, new treatments, new diseases, new therapies, new technologies, new techniques in medicine, new techniques in surgeries, blah, 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 right? So that I can stay on the top of my game. I can do that because I am single. I have no wife, no kids to take care of, and currently I don't have no girlfriend. So I mean, it's the ideal, right? I have no kids that I have to take care of, no wife, and my family members are all out of state. My God, I have so much me time, so much time for myself to improve my medical knowledge and stay on the top of my game, like the tennis player #1 in the world, golfer #1 in the world have to practice every day to stay on the top of their game. I do the same. I have the time to go to the gym 2 hours non-stop every day, 2 hours, 365 days a year. I have the time to go to bed from 9 o'clock, no exception, to 6 o'clock in the morning, 9 hours of sleep at night, so that I can improve my memory and keep it the best memory ever. My God, I'm 50 years young. My memory is stronger than when I was 20. I wish I had this memory when I was 20 years old. It was crazy. I am so good and everything, and I have the time to work 8 to 10 hours, and I love it, including Saturday. Will never give up, right? Because, well, I'm able, because I'm single, no kids, and I have such a low stress environment at home. I don't have to worry about a mansion in freaking Spain, because I don't own anything other than this apartment and a 10-year-old car, beautiful Honda Accord. But I don't have to worry about my Ferrari, about my villa in Spain, my mansion in Florida, my investment in Mexico. I don't have to, all that. Life with no headache, no trouble, no hassle, low stress. My God, low stress life. I love my life. I work only for the pleasure. I don't need to worry about retirement, because I'll never retire. I'm going to work until I'm 100 years old, because I love medicine, right? Medicine is my wife. Medicine is my children. Medicine is my family. Medicine is my love affair. Medicine is my girlfriend. It's crazy. So I can do that. But your doctor, most of the time, right? They are all married. They have kids, or they have a new wife. They have 3 ex-wives. The guy has a mansion here, another mansion there. He has a 3-car garage, and he has a big house that he can't even maintain. So he has to work like a dog, and he has, of course, the family around. So he has to be always. Do you know what I'm saying? I acknowledge that I'm privileged in that regard. Means there's not a lot of people who are able to have so much free time, so much me time like Dr. B. My God, it's crazy. And I posted a video about the solace of solitude. Sometimes my sister asked me, don't you feel lonely? Of course not. Being alone has nothing to do with being lonely. I am alone, but I'm not lonely. I don't have a girlfriend. I'm single, but I'm not lonely, because I have so much to do. It's crazy. My brain is occupied 24 hours a day, except, of course, when I sleep. But then even when I sleep, my God, I dream and blah, 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 right? So understand, why is it that your doctor's knowledge is not perfect? Why is it that you need to advocate for yourself? Why is it that the medical system, the healthcare system in America is going down the drain? And it's going to get worse and worse and worse over the years. I posted a video about this. Because, do you think it's going to get better? Of course not. It's going to get worse and worse and worse, because, of course, overcrowding, more population. We are already almost 350 million people, massive budget deficit, massive national debt, massive deficits in each state of the union, massive deficit in the federal government. I mean, we don't have the money. We have money for nothing. We are $37 trillion in national debt, climbing by $1 trillion every year. There is just no money to take care of these 350 million Americans, to give them great state-of-the-art health care from the cradle to the grave. It's just not going to happen. It's going to get worse. So make sure that you follow my videos, because I'm telling you simple things, simple tips, explained clearly, easily. I'm not doing this video for any medical professional. It's for you, the regular average Joe and Jane, and I say average Joe and Jane respectfully, who don't have any clue about medicine, so that you don't get scammed by watching these fake scammers online selling you garbage, telling you garbage. I tell you the truth, only the scientific evidence. I never tell you my opinion. I only tell you what is the scientific evidence, what is the truth in medicine. And then you do whatever you want. You want to follow my recommendation, good for you. We can age gracefully until the age of 100. Stay away from heart disease, cardiovascular disease, cancer, strokes, heart attacks, blah, blah, blah. If not, then that's okay too. You do whatever the catso you want. I love you even if you don't follow my recommendations. So remember to ask your doctor to do the blood test to check for primary aldosteronism in case you have a high blood pressure that your doctor has trouble controlling, which means you need at least 2 medications, and even with 2 medications your values are not optimal, normal, like the ones of Dr. B. I repeat, my systolic is at 105, always around 105, and my diastolic is around 70, always. It will never go above 75. Right? Remember, normal is less than 80, and this one less than 120. My blood pressure values of those of a baby, my cholesterol, my triglyceride, my liver function test, kidney function test, all of them, my hemoglobin A1C, my fasting sugar, all those of a baby. And I'm an expert in imaging, so I take the ultrasound probe, I check my carotid arteries, right? My thyroid, my heart, my liver, my kidneys, my tummy, my prostate, my balls, my penis, my bladder, absolutely normal, like as if I was 15 years old, right? I check for fat, no fat under my skin, nothing, no fat, nothing. No fat inside my belly, no fat under the skin, and I'm 50 years young, right? And look at what you can achieve if you follow my guidelines. I don't know if I ever showed you my muscles. Remember, I'm 50 years young. Look at this. Do you see this? This is Dr. B. You see this? Pay attention. Look, see? All muscle. Skin and bone, no fat. No fat, no sagging skin, no fat. It's all freaking muscle. Do you see this? Look at this. 50 years young. I hit the gym twice, 2 hours a day. I cannot show you my belly, but it's the same. No love handle, no belly. My ass is all muscle. Very cute. My ex-girlfriend used to love my ass. She was always slapping my ass saying, "Oh, you got the ass of a baby." My legs are slender and beautiful, muscular. I can run faster than a jaguar. Bring me any 20-year-old, I can run faster than him. I swear to God. On a sprint, right? Long distance, I'm not good, because for long distance, you need training. I'm not trained for long distance, right? And I don't care about training for long distance. I don't see the point. There's no point in long distance running. It makes you lose a lot of muscle. And in order to run long distance, you need to lose muscle. Have you noticed all these marathon runners, half marathon, they're all skinny. They don't have muscle. And that's very bad on the long term. I posted a video about that. I love you guys. Dr. B graduated from medical school 30 plus years ago. I took the Hippocratic Oath, which means that I will never, ever put my interest above yours. You will be always above me. I will never, ever tell you BS. Everything I tell you is the scientific proof proof and the scientific evidence. I will never sell you garbage. I will never tell you anything about my opinion. Everything I tell you is based on the scientific evidence that is published in the medical literature. Regardless of your gender, ethnicity, color of your skin, race, blah, blah, religion, politics, whether you're Hindu, Muslim, Christian, Jewish, anything, atheist, Democrat, Republican, anything in between, black, white, I don't give a cat, so I love you if you're a human being, right? I give you a big hug the same way I hug my patients, and God willing, put your questions and comment in the section down there. I will get back to you, and God willing, I will get back to you ASAP, and hopefully we see each other in the next video. Have a wonderful, wonderful evening. Bye-bye.